Hi, this is Dr. Lonnie, and I am a bone specialist. I've been studying bone and working with people with osteoporosis and bone density tests for over 25 years, and I myself have osteoporosis. I'm very interested in making sure that people are diagnosed properly, and I see a lot of errors because I work with people from all over the country, from various bone density facilities. So right now I'm going to talk about bone density errors. And these errors are just shouldn't happen. They're very simple errors, but it does point to the fact that imaging facilities or doctors' offices do not have to have people who are trained in bone density. I know it's a little shocking because we expect testing to be done properly by trained people and people who analyze them to be very, know what they're doing. But this simply is not the case. So I want to start sharing with you some of these mistakes that I see, because what these mistakes can end up doing is resulting in people being put on medications they don't need, or thinking something that they're doing, even in exercise, is improving their bone density when it's not. So I'm going to show you the case of the day, and this is going to be a bone density error that I worked on yesterday. And here it is. So what we're looking at is the hip bone density. This is the left hip. This is the most common hip that is done. One error I see on occasion, by the way, is a right hip compared to the left hip. And you don't want that either. So, because hips can be different. And it's really the femur bone, not the hip, that we are commonly called the hip. But there are two areas in the femur, and this is the femur bone, okay, where we measure bone density. One is the neck of the femur, and this is a hologic machine. This is going to look different if it's on, and you'll see additional ones that I'm going to be sharing with you down the road here on different machines. The two top ones are hologic, which is what this is, and then there's another one called GE lunar, and they have different ways in which they analyze. So in hologic, you'll see a box for the hip, and in the GE lunar, you're going to see a triangle. So anyway, let's just look at this one. So what we have here is the line, the bottom line of this box was placed in the wrong place. So what does that, and this, I drew in where this line should be. So what does this do? Well, the problem is that it will increase the bone density when they increase too much of the shaft of the femur. So what would happen if in 2 years, when this person gets a new bone density, and the person does it correctly and puts the line right here, it's going to show about a 10 to 15% loss. And the reporting doctor, if they don't catch it, and I'm telling you quite often they don't, and a lot of times these facilities are put on automatic, nobody physically looks at them. And I would say it's very important for them to be checked. So if the next person who does the bone density does it correctly, then what's going to happen is it's going to show that loss. Or the reverse can be true. I've seen many cases where people think they're gaining, they're on groups and Facebook and so forth, claiming that they've gained 10%. And if it's in the hip, I already know what's happened. It's either, there's other errors that can do it too, like the rotation of the hip. But for now, we're going to talk about this particular one that we have in front of us. The other error that occurred is that this is the rectangle for the neck of the femur. It's placed in the wrong place. It should be moved up and it should be anchored right here. So this too is going to cause an error, not as much, maybe 1% or so, but again, we want these tests done as accurately as possible. And so if we look over here on the summary of the results, we look at the T-score, which is what most of you are familiar with, you can see that the total hip, there are two places in the femur where we can analyze for bone density and render a diagnosis of bone density, meaning is it osteoporosis, is it normal, what is it? And those two areas are the neck of the femur, so it's not the neck of your cervical spine, okay? And the total hip. And the total hip includes this area all the way up to where the top line of the neck is. So it's really, this entire area is the total hip. And why that's important is because the total hip gives us a bit of different information, because it's what we call mixed bone. And it has more cancellous bone, which is similar to what we see in the spine. So it gives me, as somebody who looks at bone in detail, more data points to look at in terms of, sorting out whether or not somebody is either losing bone or whether or not their situation is severe or borderline or gray area or whatever. So in this particular case, this total is wrong, and it should be, it would probably come in around negative 2.5 or so, or maybe a little bit lower. So now I'm going to shift over to the spine. And this too is not done correctly. These lines are, wherever the lines are on the lumbar spine is what was included in the volume. It's a volumetric measurement that we're using. So whatever's selected, wherever you see the lines, that's the bone that's the area of the bone that is selected. So when you see all these jagged lines like this, the machine itself goes to the area and selects it first. But what's supposed to happen is the technician is supposed to go in and correct some of these lines if they can. So it's just sloppy work is what I would say. How much difference would it make? I don't know, a couple percent maybe. So here's the thing with, and sometimes they don't choose the right lumbar vertebrae and all that, and I will show that in future episodes of these bone density errors, because what I'm really hoping is that I can start making some waves about this, because I think bone density is really important. It's a wonderful tool that we have, and it's being misused, frankly, because people, the reporting doctors, including radiologists, are not necessarily trained. This is what I do every day. So you get good if you do things, if you're trained and you do things every day. And then of course the technicians don't have to be trained. So that if the report is wrong, I say it's on the imaging facility, period, because they're supposed to be overseeing the technologists. So what happened in this particular case is I had those corrections on those sheets that you just saw. I had the patient take it into the imaging facility. Usually they'll just fix it and probably hang their head a little bit when they see these. These are 101 errors. They just shouldn't happen. But in this case, they called me 3 times. Finally, I get on the phone yesterday with the radiologist. And he said, well, we made the changes that you wanted to make, and it didn't make much difference. I said, well, that's not possible, because that much femur, if it's included, is going to be at least over 10% difference. And he said, well, we looked at we changed the femur, the neck of the femur. We changed that. That didn't change much. We did the spine. That didn't change much. And I said, yes, but maybe it didn't change much, but you want to do it right. And I said, and the total femur is really wrong. And he said, well, we don't, literature says we look at the neck of the femur. And I said, wait a minute. There are 2 areas that we diagnose bone density in the hip. And here's the problem. The problem is this. In the next, like I just said, 2 years from now, this person has somebody do it correctly. The report is going to say she's lost 10%. All hell's going to break loose. 1 or 2 things is going to happen. If she is on a medication that is actually working, in her case, her bone density is pretty low. I think they should be on the table. She's going to be told it's not working. I've seen that too, and be taken off the drug or be put on an additional drug, because the treating physicians don't know how to read these. And that kind of makes sense. Although I think an osteoporosis specialist should know how to read them. Many of them, unfortunately, think they do, but they don't know these details. And that we should be able to rely. So I keep going back to the imaging facilities or any doctor's office who provides these bone density tests. They should be trained. Not only that, they should keep up with managing the machine to make sure that it is calibrated, et cetera, et cetera. But I'm just focusing on these, what I would call 101 errors right now, because I'm tired of seeing them. I see them every week, multiple times a week. Okay, so that's the first installment of bone density errors.